Welcome to this medicine masterclass in which we will be discussing Duty of Candour. Its definition, the rationale, the methodology and some examples of incidents. Duty of Candour was introduced as a formal regulation as a direct response to recommendation of the Francis Inquiry Report into the Mid Staffordshire NHS Foundation Trust. The Mid Staffordshire scandal concerned poor care and high mortality rates among patients in the late 2000s. As a consequence, Duty of Candour encouraged openness, allowing concerns to be expressed, allowing complaints to be raised freely without fear of retribution, and the empowerment for questions to be asked. Transparency was encouraged, allowing information about the truth, about performances, about outcomes to be shared with staff, patients, the public and regulators. Candour, any patient harmed by the provision of healthcare service to be informed of that fact and an appropriate remedy to be offered regardless of whether a complaint has been made or questions have been asked about it. Importantly, patients should be offered an apology, an expression of sorrow or regret in respect of a notifiable safety incident. To act according to Duty of Candour, tell the patient, or where appropriate the patient's advocate, carer or family, when something has gone wrong. Apologise to the patient or the advocate. Now, this was tricky because some healthcare professionals thought an apology may sound like an admission to a fault. However, an apology is viewed as an insight into the error. Offer an appropriate remedy or support to put matters right. Explain fully to the patient the short and long-term consequences of what's happened. Document either in a DATEC system or in an appropriate system so that this can help the learning of the organisation. Be open and honest with regulators to allow raised concerns to be tackled. Let's take some examples of notifiable safety incidents. A situation such as the death of a service user where the death relates directly to an incident rather than to the natural course of the patient's illness or condition. An impairment of the sensory, motor or intellectual functions of a patient that has lasted for or may last for a period of time. Any changes to the structure or the use of a patient's body. Any function that would affect the patient's sensory experience or would cause prolonged pain or psychological harm is a notifiable safety incident, as is anything that would require treatment by a healthcare professional in order to prevent death. So let's take some specific examples. If a patient arrived for planned surgery but had not been given the correct advice to discontinue their warfarin and their surgery has to be postponed, this is an incident which requires Duty of Candour. An elderly patient undergoing a coronary artery bypass graft, the patient is appropriately consented for the risks of operation, including stroke and death, but unfortunately the patient sustains a large stroke during the operation and subsequently dies. This is a serious incident that would require a Duty of Candour. If a patient experienced pain during an elective caesarean section due to incomplete anaesthesia from an epidural line and subsequently found this traumatic and then had anxiety and depression, is something that would require Duty of Candour. Another example, a doctor causing a pneumothorax while placing a central venous line, though it's a recognised complication. A patient developing a small grade ulcer while in hospital to treat an unrelated problem. They may be fully mobile now, but will require district nursing visits to help heal that issue. A confused elderly patient who was supposed to have one-to-one supervision, but the patient was left unsupervised and during that time fell and had a severe head injury, which led to a complication. A patient who's normally very shy sustains an extravasation injury from an intravenous line, and this causes irreversible scarring on the patient's arm and as a result becomes even more socially anxious or reclusive. All these are examples of incidents which require a Duty of Candour. So we've covered the definition of openness, transparency, and the importance of apologising, the rationale behind the Duty of Candour, the methodology, and examples of some incidents. Thank you for attending this medicine masterclass.